said I wouldn't walk again, but I would have to have surgery to put rods in my back just so I would be able to sit up again. I push a button, there's a beep, 3 seconds later, there's three quick beeps and the unit is standing up. My job is just to push down on the forearm crutches and I'm standing up. I'm just at eye level with people and it felt exhilarating.
I get fascinated by these kind of stories. Once upon a very near time, if someone suffered a catastrophic spinal cord injury, they would have almost zero chance of walking again. But now, what was once a piece of science fiction is becoming science fact. Let's welcome into MidPoint the CEO of ReWalk Robotics, Larry Jasinski, joins us. Larry, thank you so much for being here.
Good afternoon, Ed. Thank you for having me.
Pleasure. Larry, how many years of research went into the point where you have reached right now in that video that we just saw about somebody actually walking?
Well, this started with a man who became quadriplegic and was an inventor and wanted to do this. So he was injured in 1998, and in about 2001 or so, he decided wheelchairs weren't the answer. And he put an incredible effort in just building something at his home in Israel. So really, he started around 2001. You're 13 or 14 years into it. As a real commercial effort, you know, we're about 3 to 4 years into it. But it were the efforts of Dr. Mitt Gopher that was an incredible start for this.
What was the breakthrough here in making the exoskeleton work, making it comfortable, and making it really usable for the person who needed it?
Well, there were really 3 things. You needed batteries that could put out enough power to meet the goal of something you can use all day, or you can use in a 10K race, or you can use at work all day. So battery technology developed appreciably. Sensing technology, as you saw on the piece you put on the beginning, he heard the device beep 3 times and he moved his body. As he moved his body, that told the device to use. So we have a tilt sensor in there, which is how they control it. And then the third area is the software. If you watch someone walking, they're walking the same way you and I walk down the street. Their heel strikes the ground and they go to their toe. And that was done by a software algorithm that a computer was powerful enough to be able to mimic human gait. And that made it more efficient, where you can use it all day and you didn't have to worry about damage to joints. So those were the 3 technologies that came through that really made this possible.
How much does the whole thing weigh?
It weighs about 20 kilos or about 44 pounds.
Okay, I would imagine then that the next step in the technology is you always look to improve and perhaps making it lighter so that one day the skeleton will be much easier, because it still seems like it's a little big and bulky for some people depending on their size and their physical makeup.
Yeah. Well, the device stands on its own on the ground, so the weight doesn't matter as much to them. But you're exactly right where this will go. Think of cell phones. If I don't know how old you are, but I'm old enough when they were about this big once, and they shrunk over time. Okay, you're going to see the same thing. You'll see new materials. Instead of using metals or steel, you'll use things like carbon fiber that are lighter. So the devices will get smaller and lighter. So for the spinal cord injury population, that'll be the focus. But the other focus of this technology, it can apply to other things too. And you will see it in the future where perhaps it'll help people that have MS or stroke or Parkinson's or ALS. And those are areas of future research. But this idea of using a robot to augment the body is something that has great potential.
What's the cost of something like this? And I guess my question has to be, will insurance cover this?
Well, that's probably our biggest focus these days with our reimbursement department. The cost of it is $71,600. The product is good for 5 years or more for function. And the way we're really looking at the value, and that we've had several insurers decide to pay for it as a result of this, is the amount of money we save in terms of reduction in medication and reduction in complications that occur from living life in a wheelchair and not exercising are significant enough to make this device valuable to the insurers. And we've got some great, I've got a new one that just happened this week. We had a police officer in New Mexico who had been injured in his job, and his insurer, which is the New Mexico State Self-Insurance Fund, elected to provide him one, and he hopes to continue working. So the insurers are recognizing it. We as an industry and a company have to build a lot more data, and we will, but we've got really great data to start.
I am fascinated by this. I think it's a marvelous idea. This is something that needs to be made available to so many people who would get so much out of it in their lives. Again, the company is ReWalk Robotics. Larry Jasinski, thank you so much for sharing this story with us. Good luck.
Ed, thank you very much. I appreciate the time.
Our pleasure. Our pleasure, really. Take care. We'll change lives in a different way next hour here on MidPoint. We're telling it like it is. Stay with us.